presentation, we're talking about mental wellness, so specifically how to detect depression and anxiety. So over the course of this mini lecture, my goal is to help you understand the symptoms and risk factors for anxiety, similarly the symptoms and risk factors for depression, to identify ways to manage and prevent depression and anxiety, and identify ways to lower the risk of experiencing symptoms of depression and anxiety. So first, I want to highlight that anxiety and depression actually reduce as we age. Contrary to common belief, we don't just become sad just because we're old. Older adults experience less negative affect, being depression, anxiety, guilt, hostility, and even shyness, and show decreased attention to negative stimuli, with an increased memory for positive items as they relate to negative items. Studies show that most older adults feel satisfied with their lives despite having more illnesses or physical problems than they used to. However, important life changes that happen as we get older may cause feelings of uneasiness, of stress, and of sadness. And we'll revisit some of these ideas at the end once we've had a chance to talk about certain symptoms. But it's also important to remember that symptoms of depression and anxiety may be common among older adults, but it's not part of normal aging. So briefly, I'll talk about mental health prevalence as is reported by the Centers for Disease and Control Prevention. 20% of people who are aged 55 years or older have reported experiencing some type of mental health concern. And just over 7.7% of people who are 50 and older reported current depression, and 15.7% reported a lifetime diagnosis of depression. So at some point in their lifetime, they did receive that diagnosis. 7.6% of adults aged 65 and older reported a lifetime diagnosis of anxiety, while 12.7% of adults who were between 50 and 64 reported a lifetime diagnosis of anxiety. And then older men, it is important to note too that older men do have the highest rate of suicide among any group. So this is certainly an area for exploration and awareness. So I'm talking about symptoms versus pathology as well, because mental health symptoms are commonly experienced, but isolated symptoms are not necessarily the same as a disorder. Occasional anxiety is actually an expected part of life. You might feel anxious when faced with a problem at work, before taking a test, or before making an important decision. But anxiety disorders involve much more than temporary worry or fear. For a person with an anxiety disorder, anxiety doesn't just go away, and it can actually get worse over time. The symptoms can interfere with daily activities like job performance, work, relationships, and your ability to just do daily tasks. As you get older, you may go through a lot of changes, like death of loved ones, retirement, stressful life events, or medical problems. And it's normal to feel uneasy, stressed, or sad about these changes. But after adjusting, many older adults feel well again. Depression, on the other hand, is different. It's a medical condition that interferes with daily life and normal functioning. And it's not part of normal aging. It's not a sign of weakness or a character flaw. Many older adults with depression need treatment to feel better. So there are several types of anxiety disorders, including generalized anxiety disorder, various phobia-related disorders, and post-traumatic stress disorder, which are all commonly experienced by older adults. However, there are many others that we just won't cover today. So generalized anxiety disorder, or GAD. People with GAD experience anxiety or worry for most of the day for at least 6 months about a number of different areas of life, like personal health, work, social interactions, and everyday routine life circumstances. The fear and anxiety experienced in GAD can cause significant problems in other areas of life, like social interactions, work, and school. Symptoms of generalized anxiety disorder include feeling restless, wound up, or on edge, being easily fatigued, being irritable, having difficulty concentrating, or just kind of drawing blanks, having muscle tension, difficulty controlling feelings of worry, and sleep problems, whether that be difficulty falling asleep, staying asleep, restlessness, or just not feeling like satisfied in their sleep. A phobia is an intense fear of or aversion to specific objects or situations. So although it can be realistic to be anxious in some circumstances, the fear people with phobias feel is out of proportion to the actual danger caused by the situation or object. So phobia-related disorders include a phobia to one or more specific objects or situations. So people with a phobia-related disorder or specific phobia may have an irrational or excessive worry about encountering the feared object or situation. They may take active steps to avoid that feared object or situation and experience immediate, intense anxiety upon encountering it. They may endure unavoidable objects and situations with intense anxiety. So there's several types of phobias and phobia-related disorders, like a specific phobia, sometimes called a simple phobia. But as the name suggests, people who have a specific phobia have an intense fear of or intense anxiety about specific objects or situations, like flying, heights, certain animals like spiders, dogs, or snakes, needles, receiving injections, or blood. Another type is social anxiety disorder. It might be a little bit different in some cases, but it was previously referred to as social phobia, because people with a social anxiety disorder have a general intense fear of or anxiety toward social or performance situations. So they worry that actions or behaviors associated with their anxiety will be negatively evaluated by others, leading them to feel embarrassed. This worry often causes people with social anxiety to avoid social situations, and this can manifest in a range of situations, like in the workplace or school environment. And then the last anxiety disorder we'll talk about is post-traumatic stress disorder, or PTSD. And this is a disorder that develops among people who have experienced a shocking, scary, or dangerous event. It is natural and normal to feel afraid during and after a traumatic situation. Fear triggers many split-second changes in the body to help defend against danger or avoid it. We have this natural fight or flight response. That's a normal reaction that we have to protect ourselves from harm, threat, or danger. And most people who experience trauma will experience this fight or flight response. All people who experience trauma will experience this fight or flight response. But not everybody who experiences trauma will experience PTSD. Because while almost everybody will experience a range of reactions to trauma, most people will recover from the initial symptoms on their own. But some people will continue to experience problems and then be diagnosed with PTSD. So they might feel stressed or frightened even though they're not in danger anymore. So some symptoms of this would be flashbacks, in which we relive the trauma over and over again. And this can even include physical symptoms like our heart racing or sweating. People with PTSD might be easily startled or feel tense or on edge. They might have angry outbursts and have difficulty sleeping. So signs and symptoms of an anxiety disorder might include things like sleep problems, excessive worry, chest pain, dizziness, sweating, heart palpitation, shortness of breath, abnormal pain or indigestion, lack of appetite, difficulty concentrating, making decisions, agitation, irritability, shaking, feelings of impending doom. It'll look a little bit different for different people. You may experience one or more of these in certain capacities. But then also to note is that as adults transition into later life cycles, they do face significant changes in their lives, such as retirement, physical health problems, the loss of a spouse or a loved one, and reduced economic resources. So it's not surprising to see this chart here, that older adults might worry more about health and a disability, but have fewer concerns about work, finances, and family than younger adults. So this table here is showing that there is a difference in some cases of how different anxiety disorders present in younger patients and older patients. So older patients, again, like I said, are experiencing lower levels of cognitive distress and more severe levels of physical distress. And I also want to highlight that anxiety can look like dementia. So whether you're worried about one or both, just knowing that there are some presentations that that overlap. So things like psychomotor agitation, so difference in our ability to perform motor activities as normal. This is disrupted in older adults with anxiety as well as dementia, as is restlessness. In some cases, this rigidity or hoarding might show up in late life anxiety, but is characteristic of some dementias. Being homebound, there are some overlaps here in that with anxiety, older adults with anxiety might choose to stay home, whereas with dementia, there might not be a choice in that. Sleep disturbances also exist in both. Depression, moving into depression. So this is one of the most common mental disorders in the United States. Current research suggests that depression is caused by a combination of genetic, biological, environmental, and psychological factors. Depression can happen at any age, but it does often begin in adulthood. Depression is now recognized as something that can occur in children and adolescents, although it sometimes presents a little bit differently in these age groups with more prominent irritability than low mood. Many chronic mood and anxiety disorders in adults begin as high levels of anxiety in childhood. So depression, especially in midlife or in older adulthood, these can co-occur with other serious medical illnesses like diabetes, cancer, heart disease, and Parkinson's disease or other dementias. These conditions can often get worse when when depression is present. And sometimes medications taken for these physical illnesses can cause side effects that contribute to depression. But some risk factors, regardless, do include things like personal or family history of depression, major life events, trauma or stress, and then certain physical illnesses or medications. There are several types of depression, among the most common including major depression, persistent depressive disorder, and minor depression. In major depression, symptoms are severe. They interfere with your ability to work, to sleep, to concentrate, to eat, and to enjoy life. Some people might experience a single episode in their lifetime, but more often than not, people experience multiple episodes. Persistent depressive disorder describes depression symptoms that are less severe than those of major depression, but they last a long time, lasting at least 2 years. And minor depression, this is when depression symptoms are less severe than those of major depression and persistent depressive disorders, and they don't last quite as long. I also want to highlight very briefly, there is a difference between grief and depression, and we go into this a little bit more in our presentation on understanding grief. But grief after loss of a loved one is a normal reaction to loss and generally doesn't require mental health treatment, so it might require support or guidance through the grief process. But grief that lasts a very long time or that's unusually severe following a loss might require treatment. But that doesn't necessarily mean that it's depression. So grief and depression can be co-occurring, but they are distinct of one another. So signs and symptoms that somebody might be experiencing depression would be a persistent sad, anxious, or empty mood. Although this isn't always the main symptom among older adults. You might see feelings of hopelessness, guilt, worthlessness, or helplessness. irritability, restlessness, or having trouble sitting still, loss of interest in activities that one used to find pleasurable, fatigued, slower to move or talk, trouble concentrating, making decisions, difficulty with sleeping, whether that be not sleeping enough or oversleeping, changes in appetite, whether that be eating more, eating less than usual with an unplanned weight gain or weight loss. You might notice thoughts of death or suicide, or even attempts for suicide. There might be unexplained or unclear medical cause for aches or pains, cramps, headaches, or digestive problems, as well as frequent crying or tearfulness. So confusion or attention problems caused by depression can sometimes look like Alzheimer's disease or other brain disorders. Older adults can have more medical conditions like heart disease, stroke, or cancer that can cause depressive symptoms. But medications, like with anxiety, medications might have side effects that contribute to depression. So again, just something to note. I wanted to talk very briefly as well about the characteristics of depression, delirium, and dementia. Delirium is an abrupt change in the brain that causes mental confusion or fogginess and emotional disruption. So it might be difficult to think, remember, sleep, pay attention, and things like that if you're experiencing delirium. It's something that somebody might experience during alcohol withdrawal after surgery or with dementia. So there is a difference in onset, mood, course, awareness, and the ability to engage in different levels of activities of daily living between depression, delirium, and dementia. So something to note. When it comes to activities of daily living, ADLs are basic self-care tasks. The 6 basic ones are eating, bathing, dressing, toileting, mobility, and grooming. But then IADLs, which are instrumental activities of daily living, are slightly more complex, being things like managing finances, handling transportation, preparing meals, using the phone, doing laundry or housework. And difficulty managing these are typically more common in people who are in the early stages of dementia, less common among people with depression or delirium. So researchers are finding that there's a genetic and environmental factors that are contributing to the risk of developing an anxiety disorder, much like a depressive disorder. Although the risk factors for each type of anxiety disorder can vary, some general risk factors for anxiety disorders in general include things like temperamental traits of shyness or behavioral inhibition in childhood, or exposure to stressful or negative environmental events in childhood or even adulthood. A history of anxiety or other mental illnesses in biological ancestors or relatives. Some physical health conditions as well, like thyroid problems or heart conditions, as well as different substances like caffeine or other medications can all produce or aggravate existing anxiety symptoms. So a physical health examination is a helpful way to evaluate and rule out possible anxiety disorders or health concerns. In depression, some of the risk factors include chronic medical illness or disability, poor sleep. So as you saw before, depression can cause poor sleep, but poor sleep can also lead to symptoms of depression. And similarly for being lonely or socially isolated, as well as a genetic component, so family history of depression or other mental illnesses, stressful life events or trauma, and substance misuse. So to tie this lecture together and really drive home this idea that normal aging does not look like depression or anxiety, I wanted to include this graph here. So this graph is comparing normal aging to major depressive disorder to specific disorders, specific anxiety disorders. So memory concerns is part of normal aging. It's also part of major depressive disorder and anxiety disorders. As you can see, some of the mental health concerns involve symptoms that are not part of normal aging. But having this memory complaint and having changes in sleep patterns, there is some overlap here. But then things like appetite changes and breathing difficulty, these things come up. It might be worth considering the side effect of medications, of thinking about different medical concerns. So medical comorbidities, drug and alcohol use, or medications. Because these things, while they're not depression, they're not anxiety, they might be related to other processes of aging and then present with symptoms of depression and anxiety. So what can you do to take care of your mental health? You can engage in protective strategies like stress management, social engagement, and engaging in meaningful activities, which we'll talk about a little bit more in a second. So being proactive and trying to reduce your risk for depression and anxiety isn't always enough, but that's not your fault. There are stigmas against mental health, and we on the side of things are always we're always aware of that and trying to help lessen those. And on the side of patients and individuals, there's stigmas that you have to work against as well to try to reduce that. But don't let those stop you from getting help. Acknowledge the realness of mental health and give yourself some grace if you're experiencing symptoms of depression or anxiety. And then don't wait to snap out of it, because that's not the nature of how mental health works. Talk to your doctor if you are concerned to potentially rule out other conditions. And please do follow up with us if you have more questions about getting help and finding mental health providers. And the good news is that in most cases, depression is treatable in older adults, as is anxiety. The right treatment might help you improve your overall health and quality of life. And with the right treatment, you may see improvements that begin in as early as 2 weeks from the start of therapy. Some symptoms might start to improve within a week or two, but it might be several weeks before you feel a full effect. And then talk to people about it. Depression and anxiety hold a lot of weight, and that can be overbearing to carry all by yourself. So talk to somebody that you trust when you are experiencing these symptoms. If someone you know may be experiencing these symptoms, encourage them to reach out to somebody, if not yourself. And lastly, be easy on yourself. Take care of yourself by taking care of your mental health. That's what we have for you on detecting depression and anxiety. It's just a brief overview of what those two mental concerns look like. If you have questions, please comment or email us at pacific.memri.clinic@gmail.com. If you're interested in following up on some of the resources and reference that we use to put together this presentation, feel free to follow up on some of these listed here.